Most people are familiar with the benefits of colonoscopy. We are examining the interior of the colon and looking for precancerous polyps, which are mostly benign, and removing them and trying to prevent colon cancer. Unfortunately, that brings up the dreaded topic of colonoscopy preparation. There are a variety of preps which are available. Everything from the large volume preps, there are multiple small volume preps, all of which are very effective. Despite being a variety of preps available, there are some similarities with all the preps regarding preparation before your procedure. Almost all of the preparations require 3 days of a low residue diet. And by a low residue diet, we mean avoiding most raw fruits and vegetables and large particulate matter like seeds and nuts and kernels, which will make difficult observing the entire lining of the colon and can also technically bother the scope. You obviously have to substitute lower residue foods like chicken, bread, rice, potatoes. And again, these are guidelines. Do the best you can. In terms of medications, there are also some recommendations that we'll make. If you're on blood thinners, those will often have to be stopped variably days ahead of time. These include also antiplatelet agents like aspirin and Plavix. There's also a lot of patients now who are on Ozempic and Trulicity, Byetta. Those medications that are given daily should be stopped at least a day before the procedure, and those which are given weekly should be stopped a week in advance. And we have you speak to your prescribing providers about specific instructions regarding those medications. For most of the preps, the day before the procedure, you'll be on clear liquids alone. So no solid foods the whole day before. Clear liquids are things that you can actually see through. So unfortunately, coffee with cream is no longer considered a clear liquid. Clear liquids include things like sport drinks, Gatorade, bouillon, broth, black tea, black coffee. We also try to have you avoid anything that's red or purple because that actually can look like blood in the colon. Despite all of these restrictions, the good news is there are no dietary restrictions after your colonoscopy, so you can eat whatever you want. One of the most common preps that we use are the PEG preps, also known as the gallon. Those are a large volume lavage which measures 4 liters, which is also known as Go Lightly, Co-Lightly, New Lightly, has a lot of different brand names. You basically will go to the pharmacy, you'll be given a large gallon container which just has powder in it and no liquid. What you'll do is you'll mix up the fluid as noted and then drink 8-ounce glass of it every 15 to 20 minutes until half of the 4 liters is consumed. Some people start to feel a little bit bloated or nauseous if they're taking the prep. Most people will start to experience some diarrhea after drinking the first half of the prep, which is to be expected. After that's completed, you have a little bit of a break, and then you'll have to consume the second 2 liters. That's usually taken about 5 hours before your arrival time. So yes, indeed, if you have a early morning appointment, say 7:30 with a 6:45 arrival time, you have to finish drinking that whole second dose at least 2 hours before. So we recommend you start drinking it about 5 hours before, which if I can do the math is somewhere around 1 o'clock in the morning, which is one of the downsides to split dosing. But we do know that split dosing gives a much better prep and is better tolerated. Lots of people ask if you can take the whole gallon the night before, but it doesn't work as well, and it's important to split it as recommended. In appropriate clinical situations, there are some other preps known as the low volume preps. They don't involve drinking as much fluid. They do work very effectively, but they sometimes are not appropriate for certain patient populations. There are quite a few of them available commercially. They're all very similar in that they are doses of medication followed by volumes of clear liquid or water, and they achieve the same effect. One of the most common ones is Clenpick. The instructions for that are similar to Go Lightly. Clear liquids the day before, the low residue diet for 3 days before, and then the evening before, also a split dose regimen. You take the small volume of Clenpick, which is 5.4 ounces, and you consume that, and then you follow that by 5 8-ounce glasses of clear liquid. And the more you drink, the better, because the better the cleaning will be. The next morning, very similar to the Go Lightly prep, you have to start usually around 5 hours before your arrival time. You drink the second ounce, it's 5.4 ounces of Clenpick, followed by 3 8-ounce glasses of clear liquid. And again, you can drink more than that to help to cleanse the process. The other low volume preps are very similar. They have their own specifics based on the manufacturer, etc. People often ask if you can start the prep earlier. These dosing schedules have been worked out to maximize the cleanliness of the colon at the time of colonoscopy. So if you take it earlier, and an hour or so isn't going to make a difference, but many hours earlier, you risk that the colon will not be adequately cleaned, because even though you're not eating any solid food, your body continues to make waste, which can obscure the lining of the colon, which is why the timing is somewhat important. Same reason you don't want to drink the whole gallon the night before, which was the prior way that we used to give these preps, until they did studies and realized that the split dosing, half the night before, half the morning of, does a much better job of cleaning out the colon. People often ask why they were given the gallon prep versus some of these other low volume preps. That's a decision based on your medical history, age, and comorbidities, and it's based on the safety profile of the medications given. The most important part of a colonoscopy from a patient standpoint is an adequate prep. And hopefully this conversation has demystified some of the prep issues and clarified the importance of an adequate prep.